Your division continues to work with IH, Doctors of BC, the Ministry, local communities, and other key stakeholders to advocate on behalf of Kootenay boundary physicians. At the Division AGM in October, IH committed $500,000 to develop a proof of concept for the patient medical home in the Boundary region. Collaborative planning with IH, the Division, and Boundary medical staff created a detailed model description and decision brief, which has been approved by the IH senior executive team. This primary care model is now in the implementation phase in the Boundary and includes additional RNs, social program officers, and integration with existing IH home health and mental health staff. The division continues to support physicians in clinic with multiple initiatives, including the recently completed EMR optimization project, which has helped clinics using the Profile EMR integrate over 60 new auto-populating forms directly into the EMR. Kootenay Boundary physicians have found coaching to be a useful tool in supporting meaningful improvements in practice and life, whether serving as a thinking partner to bounce ideas off or inspiring desired changes. 5 GPs have utilized the service over the past 6 months, and further funding is now being sought to continue the project. The Pathways and Fetch websites continue to grow. Pathways is now generating over 100 sessions weekly and 500 unique page views from GPs in the region. Fetch has had over 12,000 unique visitors from all over Kootenay Boundary in the last 6 months. Promoting Kootenay Boundary to GPs across the world is a key priority for KB Division. Participating in events, running social media advertising campaigns, and acting as the information hub for new candidates. In the last year alone, 12 new GPs have been recruited and 9 clinics receive recruitment and retention support. The division continues to support medical education in the region and enables GPs to earn roughly 1,500 certified MainPro Plus credits every year locally. The Kootenay Boundary CPD program has been lauded provincially for its unique approach to bring courses that would otherwise be unavailable to rural areas. In late 2016, the division connected with Selkirk College to support the Pre-Med program. A unique scholarship has been created that will help local youth begin a career in medicine, with over $8,000 per year in funding raised, thanks to a very successful donation drive and the generosity of GPs across the region. Division and shared care projects continue to support GP members, specialists, and patients, improving processes, increasing collaboration, introducing new technologies, and ultimately improving patient care. The Motherwise mental health support groups, which ran in collaboration with community groups across Kootenay Boundary, significantly reduced new moms' level of depression. Before the program, the average EPDS score was 13.04, and after the program, it dropped to 9.17. This decrease was statistically significant at the 1% significance level. The first ever Regional Residential Care Quality Improvement meeting took place in 2016. With the full collaborative team taking part, including physicians, site managers, nurses, interior health administrators, and private partner site leaders. ER transfers have been reduced by 35%. The team is on track for a 15% decrease in hospital admissions and a 3% reduction of patients on 9 or more meds in the last 2 years. A new dementia roadmap tool for practitioners and patients was launched in March 2017 and has already been adopted by multiple sites across Kootenay Boundary, BC, and Canada-wide. Kootenay Boundary Division continued to advocate for better understanding and consideration of the social determinants of health in an effort to improve health outcomes. The division spearheaded a province-wide social determinants discussion in late 2016 and provided a further CPD event in Trail to educate GPs, including presentations by local not-for-profit groups providing a host of services to support residents in poverty and other difficult situations. Chronic pain work in the Kootenay Boundary continued through the end of 2016 and early 2017 with the completion of the PSP chronic pain module in Trail, the support of a new chronic pain workshop in Nelson, the development of a directory of services for chronic pain patients in both Nelson and Trail, and the introduction of a pilot program in Trail to explore the benefit of an OT chronic pain advisor to support GPs and patients dealing with complex chronic pain issues. The Shared Care Telehealth Initiative has been driving the adoption of new technologies to improve patient care. The Electronic Access to Specialist Expertise, or EASE project, has brought video conferencing technologies between Trail ICU and ED departments around the Boundary. Telehealth is now available to connect patients with specialists, and in the last 3 months, these services have saved KB patients over 6,000 kilometers of driving. KB Division was also chosen as the second community to introduce MBMD secure messaging, and within 4 months of launch, 70% of KB physicians are now using the system. The Shared Care Child and Youth Mental Health and Substance Use West Kootenay Local Action Team is the only team out of 64 teams in the province to be awarded additional prototype funding to implement a wraparound model of care for children and youth with moderate to complex mental health and/or substance use issues to reduce hospital admissions and ED visits in the region and improve coordination and information sharing between physicians and professionals. The Shared Care Regional Diabetes Committee facilitated a complex change process needed to improve diabetes service provision regionally. A GPSP model at the Trail Diabetes Education Center was established. The new model resulted in an increase of 202 new referrals and 65% of patients experiencing an improvement in their HbA1c and a decrease in A1c levels at a significance level of 1%. These activities by your division could not have been possible without the support of many GPs in the region who take the time to be involved and guide these projects. The Board of Directors would like to thank all those involved in division and shared care work in Kootenay Boundary. If you have any questions or would like further information about any of the projects mentioned in this video, please contact KB Division Executive Director Andrew Earnshaw at aearnshaw@divisionsbc.ca. Thanks for watching.